If I didn't care more than words can say.
Life is a journey from birth to death, and although there is much focus placed on birth, there is very little on death. However, death and dying is something which affects each and every one of us. It is important to consider what sort of care do we want at the end of our life. Palliative care is the total care of patients at the end of life, whose illness is no longer curable. The goal is to achieve the best possible quality of life for patients and their families, both through the dying process and afterwards. Palliative care can be provided in various care settings, such as a hospice, people's homes, a hospital or a nursing home. We know that wide regional variation persists in the provision of hospice beds in Ireland, meaning that in some areas of the country, patients are being denied access to services simply because of where they live. It is important to plan how we deliver and pay for this care.
Hi, my name is Tyrrell. I'm doing a PhD here in Trinity in Health Economics, and my research looks at the cost of palliative care both in the Irish context and comparing it internationally.
The reason why we need to carry out this study is that at the moment we know very little about what is the best way of delivering care for people with the need for managing their symptoms and recognizing that a lot of their illnesses are not curable, but nevertheless where we can improve their quality of life. In particular, there are different ways of providing palliative care. Sometimes it's done more to people in the home, sometimes it's done more within a facility, a hospice or a hospital setting, and we don't know very much about what works best and what is in the best interests of the service users.
My first study is an economic evaluation of palliative care in 4 regions of Ireland, so comparing the Dublin region with 3 other regions of Ireland in terms of the patterns of service use and the differences in costs associated with the last 3 months of a person's life.
So what we're trying to do in this study, and indeed in the related studies we're carrying out, is to get a better understanding of who should do what, how they should do it, what is good value within this area.
The value of my research is that it will identify patterns and costs for different models of care, highlighting systematic variations with a view to informing policy decisions on resource allocation for palliative care services in Ireland. This has the potential to allow people on their final journey in life to access the best possible services to meet their needs and the needs of their families.